Good evening, everyone. Welcome and thank you for joining us for our fourth discussion on COVID-19. I'm Jennifer Schaefer, the Assistant Vice President for Development for the College of Medicine and Life Sciences at the University of Toledo. For today's presentation, please submit your questions in the chat box and we will get to those at the end of the session. We will answer all of those questions after Dr. Smith speaks. Now I'd like to turn things over to our moderator, Dr. Christopher Cooper. Dr. Cooper is our Dean of the College of Medicine and Life Sciences. He has his medical degree from the University of Cincinnati, where he graduated as a class valedictorian. He completed his cardiology residency and fellowship programs at the Brigham and Women's Hospital in Boston, which is associated with the Harvard College of Medicine. Dr. Cooper has been a part of the University of Toledo for more than 25 years. In the field of cardiology, he is known across the globe for his research, and he has received more than $25 million in external funding for his research initiatives. His work has been published in numerous journals, such as the New England Journal of Medicine. I will now turn it over to you, Dr. Cooper.
Thank you so much, Jennifer, and welcome everybody to today's webinar. So as Jennifer mentioned, I'm Dr. Chris Cooper, Dean of the College of Medicine and Executive Vice President for Clinical Affairs here at the University of Toledo. As an introduction, our College of Medicine and Life Sciences is in the business of discovery through nationally recognized research, patient care, and we train many of our region's physicians, scientists, and other healthcare professionals. The compass that guides all of us is our mission to improve the health in our communities and in our region. And to that end, in our community, there's a need for reliable, accurate information about COVID-19. What I'm excited to say is that this afternoon we have a panel of nationally recognized leaders that include virologists that work with COVID-19 and other potentially lethal viruses. We have infectious disease specialists that are on the front lines of the COVID-19 response here in our region and who are nationally recognized for their work. A pharmacist who's leading UTMC's efforts to distribute the vaccine. And tonight we also have a special guest joining the panel from the Lucas County Health Department. Our goal is to get you solid, reliable information out to our community that you can trust. I'd like to take a moment to introduce our presenters and panelists. So as I mentioned, we have a special guest tonight, Dr. Daniel Cadigan, who has been with the Lucas County Health Department since 2020, serving as medical director. He has a strong interest in healthcare quality and in promoting preventative and social measures to improve community health. Dr. Cadigan has been a primary care physician in our region for 25 years with experience both in rural and urban care. He earned his bachelor's medical degree and completed his residency program at Memorial University in Newfoundland, Canada. Dr. Joan Duggan is also on our panel tonight. Joan is an infectious disease specialist and a professor in the Department of Internal Medicine, as well as the Senior Associate Dean for Faculty Affairs and Development at the University's College of Medicine. She earned her medical degree here in Toledo from the Medical College of Ohio and completed her infectious disease fellowship at the University of Michigan. She has received numerous awards and millions of dollars of research funding and has over 130 publications. Dr. Jennifer Hanrahan, also on our panel tonight, is an infectious disease specialist and the chief of the Division of Infectious Disease here at the University of Toledo. She earned her medical degree from the Chicago College of Osteopathic Medicine and completed her fellowship in Cleveland at University Hospitals. She's written book chapters, abstracts, and review articles. She's passionate about education and mentoring of students, residents, and fellows, and is invited to speak locally and nationally on COVID-19. Dr. Jason Huntley is an associate professor in the Department of Medical Microbiology and Immunology and director of our biocontainment facility that studies the live COVID-19 virus and other lethal infectious agents. He earned his PhD from Iowa State and was an NIH ID fellow. Dr. Huntley has published prolifically, has over 50 invited research presentations nationally and internationally, and has been awarded more than $4 million in federal and other research grants. As we've remarked previously, Dr. Huntley last year introduced Dr. Anthony Fauci at the National Biothreats Conference in Washington, D.C. It was then that Dr. Fauci opened the nation's eyes to a novel and deadly viral pneumonia sweeping through China, now what we know as COVID-19. Finally, and not lastly, I introduced Dr. Russ Smith, who is the Chief Pharmacy Officer and Quality and Safety Officer at the University of Toledo Medical Center. Dr. Smith has more than 25 years of academic pharmacy experience. He oversees all clinical pharmacy activities on the University of Toledo's campuses. He earned his bachelor's degree in pharmacy from the University of Toledo and a doctor of pharmacy from the University of Shenandoah. Dr. Smith is leading the university's COVID immunization program. I'm now going to turn over the presentation to Dr. Cadigan. Dr. Cadigan, thanks so much for joining us, and we're very grateful that you're here.
Thank you, Dean, for the opportunity to be here. On behalf of the Lucas County Health Department, we really appreciate the opportunity to share information with the community. And as a primary care physician, I'm quite honored to be in the company of the people that you have here presenting today. Wanted to give an overview of where we stand at this point in terms of vaccination in COVID-19 in Lucas County. We could switch to the next slide, please. Want to touch on the present COVID-19 rates, where we are in terms of vaccination, and briefly on the ongoing preventative measures that we need to look at to help contain and make progress in further containment of COVID-19. We go to the next slide. Thank you. In Lucas County, we had our first case slightly over a year ago. The timeline recently changed back, and the first documented case was in March 3rd. The first death, unfortunately, was on March 18th of 2020. We now stand at 37,000 total cases and 793 deaths. And to put things in perspective, since late November of 2020, 1/3 of all the Lucas County deaths recorded were COVID related. And move to the next slide, please. So over the last 7 days, if we look at our local data within the county, we have a daily cases average of 92 cases. We are averaging 172 cases over a 2-week interval per 100,000 population within the county. And we have a test positivity rate based on hospital data within the region of about 8%. The ideal in terms of test positivity, what we're looking for is 5% or less. Certainly the governor's data released daily at the state of Ohio, we're running 3.7, 3.8%. So, in overall data, our positivity rate is above the ideal 5% threshold. Go to the next slide, please. This is the information we generally present on a daily basis as an update. And I think the takeaway here, if we look at this, if we look at our 30-day confirmed case counts extending into the past weekend, is that we have been holding fairly steady as the data comes in, right around the same level over the last month in terms of confirmed case daily. There generally is some lag in these, so the numbers aren't completely accurate. Sometimes as the cases come in, those numbers would go up over time, although not necessarily go down. But we're still running, over the last week, we saw an increased caseload within the state on several days, and that was reflected certainly within our caseload within the community. We move to the next slide, please. The big issue we're dealing with now, and if people are looking at the media, is the issue we're dealing with variants. Right now in the state of Ohio, and within the US, the prominent variant is what's known as the UK variant, which is the B.1.1.7 variant. We have 175 as of Sunday confirmed cases of this variant within the state of Ohio. I believe that number now has trended up above 180. The South African variant is a variant of concern from a vaccine perspective, as the vaccines often tend not to be as effective based on the data we have. And we're fortunate that we've not seen any of those cases within the state as of this time. We have one reported case of the P1 variant, which is the Brazilian variant. And as of today, we do have a confirmed case of one of the California variants. Variants that developed within the US itself over the last month as well. There's been discussion of a Columbus variant, which appears to be, in my understanding, a change somewhat from similarity, more similar to the UK variant than to the other variants that exist worldwide. This is a rough list. There have been variations seen, particularly with a recent increase in cases in India, where they've seen some unusual variants that they've not seen elsewhere. And certainly with any virus as it spreads, you can expect to see variation regionally, particularly. But with international travel, these variants can often then spread worldwide. And as we talk later in terms of the vaccination, certainly right now the concern is, do we get a handle on COVID-19 from a public health perspective and keep the spread and the incidence in the community down to a level where we limit the spread of these variants and get to work with the devil we know rather than the devil we don't know or the devil we partially know. And right now, in terms of vaccination, certainly we do have at least a fair measure of protection that's felt against the UK variant. Could we move to the next slide, please? So in terms of the vaccines we have available and that we've been distributing through the health department and community partners, the initial vaccines approved under the emergency use authorization were the Pfizer and the Moderna vaccines, which are messenger RNA vaccines. Those are a 2-shot series with a 95% efficacy against the B1, which was the original prominent COVID strain that we've seen. It appears that against the UK strain, the B117, that there's about 75% effectiveness, although most of the studies that have been done with that have been done in lab, not we're getting information worldwide about individuals, but that's going to take time within individuals themselves. But it appears that the present vaccines, the Pfizer and Moderna, as well as the Janssen, do provide a fair degree of protection against the British variant. The most recently approved vaccine was the Janssen vaccine, which is somewhat different than the Pfizer and Moderna in how it's delivered. All of these vaccines work by delivering a recipe to our bodies to make a component of a spike protein, which is part of the protein that the virus uses to invade your cells and cause infection. And with that recipe, we can produce that protein for a short time frame to allow our immune system to build antibodies to it. The Janssen vaccine, or Johnson & Johnson as it's also known, actually uses a pretty benign virus that we don't tend to have significant illness or reaction to, and it incorporates the viral code into that vaccine to get it into our system so that we can then recognize it and make cells, make antibodies and build our immunity. The AstraZeneca vaccine, we recently were able to release part of our stockpile to our friends up north, where my family is in Canada. Obviously, there's been some information in the news out of Europe lately in terms of the AstraZeneca vaccine, which I'm sure will be touched on later. And then there are others in development. Probably the most prominent is the Novavax vaccine, but none of those are approved for use in the US at this time. Could we move to the next slide, please? So where do we stand in Lucas County at this point? We have given, as of Sunday, it was 114,000 first doses of vaccine. The majority of the vaccine given initially was the Moderna and Pfizer, so within several weeks of that, there was a fair degree of immunity developed. That correlates out to about 26% of our population within the county. We have certainly also, in terms of people that work within the community, helped the vaccination efforts when individuals from surrounding counties are vaccinated as well. We have fully vaccinated approximately 73,000 people, or close to 17% of our population. And the big take here, which certainly has decreased hospitalizations and significant illness in that age group, is that we have a roughly 70% uptake of vaccination in the at-risk group, highest at-risk group of individuals age 65 and over. And we're seeing some changes now in terms of hospitalization data nationwide, that, you know, some more of the more severely hospitalized patients often are in a younger age group, likely because the at-risk older age group have had such a successful uptake of the vaccination effort. Could we move to the next slide? The big issue we have is vaccinating our communities of color. And certainly in terms of the data here with regards to the Black or African American community and Latino communities, we're running about 12.5% of our African American community in Lucas County in terms of vaccination. So it's trailing behind the overall vaccination numbers significantly. The Latino community, we're running at about 10%. Interestingly, and I did not show the data here, is that in one of the highest risk groups as well for complications of COVID-19, which is the Native American Indian population, the vaccine uptake actually has, while not as good as the overall numbers, certainly is in a 12 to 15% vaccination uptake. Could we move to the next slide? So in terms of improving access to the vaccine, and certainly in terms of making sure that our communities of color are vaccinated at an appropriate level, given their high risk for COVID complication relative to the overall population of Lucas County, we've looked at where we may stand in terms of the difficulties in people getting vaccinated if they wish to do so. And we've been able to divide those up into predominantly 3 areas where we've seen problems. The first problem has been access. The vaccine process requires registration generally via computer. Technology access can be a problem for a number of people. And because of, particularly with the Moderna and the Pfizer vaccines, the requirements we have for cold storage, the time frame when the vaccine is thawed and reconstituted and drawn up if it has to be used, these have generally been given in larger facilities such as the Lucas County Rec Center, and for a lot of people, transportation to those areas may be problematic. The other issue in terms of getting equitable access has been the actual times at the clinic themselves. Particularly if somebody has low income status and has difficulty in terms of losing any income from an afternoon or morning out of work, it's an issue in terms of both the ability to leave work physically and the income loss to their family by having to leave and travel and do a clinic during the day. And for a number of individuals, certainly in high-risk groups who are caring for children at home, childcare, to be able to go to the vaccination site to be vaccinated has been an issue. We're all aware of the information gap and misinformation and mistrust across all communities and all groups. Certainly this is not strictly a community of color issue, and we're doing our best to try to get the information out regarding the safety of the vaccine, honest discussions regarding potential side effects and effectiveness in an effort to vaccinate the largest number of people within the community that we can. Could we move on, please? So in terms of improving our access, the Lucas County Health Department, along with our community partners, have put forth a commitment to get 20% of our weekly vaccine allotment for communities of color. And certainly as we vaccinate these higher risk groups, we also lower the burden of COVID-19 disease within the community and the transmission within the community itself, so everybody benefits. In terms of the barriers to vaccine scheduling, in terms of having to access a computer and having good internet access at home, the Area Office on Aging has partnered and done a fantastic job and helped getting people scheduled. The United Way 211 line has also helped with that. And Toledo-Lucas County Public Libraries have agreed to serve as sites for people to register, since they're trusted sites within the community. We are trying to get communication out from trusted partners to promote the vaccine availability and the safety of the vaccine, working with the faith-based groups, the International Ministerial Association locally, NAACP, the Farm Laborers Community Organization, and the other organizations as well, as mentioned, to get that information out and to promote the availability to at-risk individuals. We've recently started a commitment to try to hold pop-up clinics and clinics in areas where there is easier access, particularly in zip codes or in other areas of the city, on breakdown, where it's easier for people to get to without having to travel a large way. The biggest site certainly for those has been the UAW Hall in Ashland, which is in close proximity to a lot of our at-risk population. One of our partners recently held a pop-up at Central Catholic High School, and the federal qualified health centers as well have been available to give vaccines, certainly to people within their region and their service area. Could we move to the next slide, please, Ken? So in terms of scheduling an appointment and getting that information across the people, the health department, the top two websites, certainly the original has been our Lucas County vaccination site, where there's a link to connect you in to register for vaccination. As we moved into the state system over the last week or so, the gettheshot.coronavirus.ohio.gov site can link from the Lucas County Health Department site, but that site directly will enable people to register. For those that need assistance, the United Ways 211 line has been able to assist people that require multilingual support, that don't have access to technology, by registering them over phone. They've also been able to offer transportation help to get people to clinic sites. The Area Office on Aging, and the numbers listed there, for seniors has been doing a yeoman's job in terms of getting people assisted in signing up. The VA operates outside of our scope with the health department, but the VA has made vaccination services available to all veterans. And the Toledo-Lucas County Public Library, as mentioned there as well, has hubs in each facility to enable people to register for vaccine or over the phone. I mentioned the V Project website. The V Project has been doing a great job in terms of getting information out. I've been involved with the provider committee, and if people have access to their website, there is information on there both about possible links for scheduling, and the other important thing is actually links for transportation. TARDA has stepped up in terms of providing transportation options to get the vaccination sites. Okay, can we move to the next slide, Kim? And the big thing coming up, certainly in terms of improving access and hours, both, is we have been selected by the governor for the Lucas County Health Department to run a regional vaccination mega site, which we run at the Lucas County Rec Center. And we have, at this point, believe 5,000 doses in that range of Johnson & Johnson vaccine committed for next week, and several thousand of the mRNA vaccines, I believe the Moderna, that we'll be able to start giving at that site starting next week. And with that, we're going to expand some evening hours and at least try to have a day on the weekend for those individuals that are working and may not be able to get to the site at other times. So that should improve access as well. Okay, we go to the next. So I'm going to open it up to all the esteemed colleagues and these great physicians that are here to answer questions today. But you know, from our perspective at the health department, from my perspective as a primary care physician, and in my own perspective as a highly at-risk individual for COVID-19, I'm a stage 4 lung cancer survivor and asthmatic, and therefore at very high risk for complications if I was to contract it. Then certainly the main goal is to reduce the rate of transmission within the community. If we slow down the rate of transmission, I always liken this to people as the normal status with COVID-19 is that everybody has a small campfire going in their backyard. And the goal of vaccination, if we vaccinate, it becomes every individual holding a candle in their hand in the backyard. If we look at the development of a variant that can spread more easily and potentially be more lethal, and turn back some of the progress we've made. It's kind of like the campfire that turns into a bonfire raging out of control and sets half the neighborhood on fire. If we vaccinate, if we limit our spread, and with our ongoing preventative measures as well, with masking and distancing, we limit the development of those variants, and we're less likely to have that bonfire develop that takes out half a neighborhood. We may not put out the fires, but at least we keep it down to a small candle in everybody's hand. And the goal for all of us is to win this race against COVID-19. And at this point, our best effort with that, outside of the standard prevention, is to let vaccination win the race. Next slide, and last slide. And I've told people my personal goal, if I wanted to summarize it up in one phrase for everybody, we all want normalcy again. Where people are tired of masking, people are tired of not seeing their friends and family. If we work on all of the preventative measures we have, the best recommendations of our public health officials, and particularly we vaccinate to that 80% level to get herd immunity, we get our normal back. So let us all work going forward to try to get our normal back. That's all that I have to say at this point. Thank you.
Thank you, Dr. Cadigan. So right now, I want to change gears just a little bit because Dr. Hanrahan has to sign off relatively quickly to deliver a lecture to our medical students on COVID. And so Dr. Hanrahan, briefly, President Biden recently said we'll be getting back more towards normal by the 4th of July, but Dr. Rochelle Walensky recently said that she has a feeling of impending doom regarding the COVID pandemic. What are your feelings about the way things are going, and what would be the drivers for the feeling of impending doom?
So there's a number of areas in the country where there are increases in cases occurring right now. One of those is our neighbor directly to the north, Michigan. We're seeing big increases. So, just to be clear, the rates we're seeing in Monroe, for example, are similar to what we were seeing at the height of the pandemic. So while we're doing better in Ohio than Michigan is currently doing, there's danger, of course, that could bleed over. And it's not clear if the reason that they are having this problem is because they were closed down for a very long time and are now open again, or if it's that there's not enough immunization. It's really not clear what's going on. So, I think we have to wait and see. I think the next couple of weeks are going to be very important. And, I think we're going to have to wait a little bit, but I would really encourage everyone to get vaccinated. And I'm sorry that I have to sign off, but I was just called to my other event. They're nervous that I'm not there. So thank you. Get vaccinated. That's the message.
Thank you. So I'm going to direct this one then to Dr. Cadigan. So the vaccines work? Do they really protect us? If you're fully vaccinated, can you spread COVID to other people? I mean, how effective really are these?
And the big effectiveness right now in the vaccines is we're seeing generally 95% effectiveness for certainly symptomatic disease. And I always tell people if we look at 95% for Moderna and Pfizer and the 75% range for Johnson & Johnson, then, you may still pick up COVID and be ill enough to be at home and feeling sick for a few days. But all of these vaccines have been very close to 100% effective at preventing hospitalization and death. And although none of us want to pick up a COVID infection, then certainly being at home and ill for a few days is certainly a whole lot preferable to being in hospital for a prolonged period of time with potential death or long-term complications from that. The issue in terms of the big issue in terms of vaccination is not just protecting ourselves, but protecting others. And, we were told initially that, well, this will keep you from getting sick. We don't know how it's going to affect transmission to other people. So what if you have mild disease and you're not significantly symptomatic, you have some sniffles, you don't think it's much of anything, and you go about your normal routine, and you're going to spread COVID to somebody else if you've been vaccinated. And I know there was a study I saw just within the last week that actually showed that with the predominant transmission being from nasal passages and airway secretions, they did show that there was a very, very decreased load of virus in the nasal secretions of individuals that have been vaccinated. So we have to presume we've been vaccinated that we still could potentially transmit illness to others, but certainly the likelihood of doing that is exponentially lower than it would be from somebody with mild disease that was not vaccinated just because of less virus in the nose.
Very good. All right, so right now we're going to shift over and I'm going to turn the program over to Dr. Jason Huntley. And Dr. Huntley, take it away.
All right, thanks, Dr. Duggan. Next slide, please. So today I'm going to talk about variants. You heard Dr. Cadigan talk about it. He showed some statistics here from Lucas County. I want to take a step back and look at more a U.S. perspective or national perspective. Again, you've heard about the UK variant or B117. They account for about 10% of cases nationally. The South African variant or B1351 accounts for about half of 1%. And the Brazilian or P1 variant accounts for less than 0.1%. And again, this is nationally. So yes, these are classified as variants of concern because of increased transmission and increased risk of causing severe disease, but the incidence is fairly low right now. Next slide, please. So, you've heard Dr. Hanrahan talk about how things are getting worse in Michigan, and you can see that the variants of concern cases in Michigan are, in this case, data from the CDC, and in a worse category than they are here in Ohio. And certainly, we've heard a lot of concern. Dr. Duggan brought up a quote from the CDC director about impending doom. I mean, Florida is not in a good position right now. And with spring break either having finished or people talking about going on spring break, and you heard about the state of emergency issued in Florida, it's not a good place to go or be right now. Again, the variants of concern are increasing there. However, right, the silver lining is that across the country, 98% of the variants we see are that UK variant. And the data from the vaccines indicates that the vaccines do protect quite well against that UK variant. Next slide, please. So again, Dr. Cadigan kind of touched on this. Viruses naturally mutate, and there are in fact many variants circulating throughout the US right now. So again, the B1 is kind of the major one, and that's kind of divided into other groups. But the B117, you can see in that salmon color, the UK variant, again, it's about 10% right now. Again, there are at least 2 California variants we know about. There's a New York variant. But if you look at these bar graphs, you can see that the UK variant in that kind of salmon color is increasing. The B1429, which is another variant of concern, a California one, you can see that that's increasing. But that South African and the Brazilian variant you don't see as a major component right now, although they are variants of concern. Next slide, please. Again, touching on this, just yesterday, a national study came out from the CDC. This was conducted at 4,000 healthcare personnel, doctors, nurses, first responders, firefighters, people in nursing homes across the country, Arizona, Florida, Minnesota, etc. This compares and looks at efficacy of Pfizer and Moderna vaccines, not Johnson & Johnson. These 4,000 healthcare workers were swabbed weekly for 13 weeks. And here's the point, as Dr. Cadigan pointed out, 80% after the first dose had no detectable virus. So it reduced not just disease, but the possibility of transmission or infection. And after the second dose, there was a 90% reduction in infection, which again means that those people could not transmit it. And again, to be clear, these aren't just normal people in the community. These are people exposed every day in high-risk situations, in emergency rooms, in nursing homes, etc. So these people were exposed, in theory, to high levels of the virus. So the vaccines are very protective. And this was done recently, as I just showed you, with all these variants circulating throughout the US. So yes, they block disease and they dramatically reduce the risk of transmission to other people. Next slide, please. So again, where are we? Again, both Pfizer and Moderna have looked at the efficacy of their vaccines against the UK variant. Both companies noted there was no loss of antibody inactivation, or what we call neutralization, of the UK variant. Both companies also looked at inactivation of the B1351 or the South African variant. They did note reductions in antibody inactivation. However, the important thing to note is that these RNA vaccines induce a lot of antibodies in people that have been looked at in clinical trials, as well as people currently vaccinated. So it overstimulates, or not over, but it stimulates a lot of antibody, much more than what you actually need to clear virus. And antibodies are only one measure of protection. So they also stimulate B cells, T cells, and other immune components. So just because the antibody effectiveness may be reduced, you still have other facets or arms of your immune system that can attack infected cells or clear the virus. So let's wait and see. Again, the data from Johnson & Johnson, although it is lower, right? The efficacy data, some people are worried about getting the Johnson & Johnson vaccine because it's not as good in terms of efficacy numbers as Pfizer and Moderna. But the advantage of Johnson & Johnson is it was tested worldwide when variants were increasing, including in South Africa. So I think this can tell us some really important data. The efficacy data from South Africa was 57% compared to 72% in the US. So that difference, right, of about 15% tells us how good the Johnson & Johnson vaccine protects against just the South African variant, right? And I showed you the variants here in the US. Yes, the South African variant may increase, but right now we're in really good shape. And that's the importance of getting everyone vaccinated right now. And again, the important thing is that these companies aren't just standing still. Pfizer and Moderna have both filed with the FDA requests to evaluate in clinical trials booster vaccines that specifically cover the South African variant. So with that, I'll turn it back over to Dr. Duggan.
So, Dr. Huntley, briefly, talk to us a little bit about how the virus actually emerge and spread. I mean, this virus seems to mutate really rapidly. Is that expected for a coronavirus? Is this something unusual? Is it just, what's going on with that?
No, it's very expected and, similar to what we see with influenza virus as well. I mean, that's, as you know, from influenza virus, not only does it mutate, but we have to come up with different vaccines every year to cover the mutations that have occurred over the course of the year. The same thing is happening with coronavirus. It's expected. With the high infection rates that we see, we expect more mutations to occur. Dr. Cadigan, talked about that too. We, in fact, have a Columbus or an Ohio variant. I mean, there's sure to be other ones that pop up. So there is actually a race going on right now. The faster we get people vaccinated, the more that people stay compliant with mask wearing, social distancing. If we can get infection numbers back down, again, we've had a 20% uptick over the past 2 weeks. If we can get numbers back down, more people vaccinated, that's fewer chances for the virus to mutate.
So does that mean we're not going to need to get a higher rate of herd immunity in order to control the pandemic, even with these more contagious, potentially nastier variants that are circulating, so we can get back to our normal sooner?
I mean, it's a little too early to tell, but all indications from other vaccine campaigns, measles, mumps, rubella, you name it, herd immunity is pretty much the same, right? We need somewhere in the ballpark of 70 to 90%, and it's always a guess, right? But we need to get as many people vaccinated as possible to prevent more infections, to reduce the chances of more variants popping up, but that the variants don't increase the numbers of people we need for herd immunity, sorry.
So given the importance of vaccinations, I'm going to switch over then to Dr. Smith, because we have a couple of questions coming in from basically a pharmacy standpoint on the vaccines. So let's switch gears and talk about AstraZeneca and blood clots for a minute. So for a while, the European Union held off on the vaccine, then opened it back up. And so, Dr. Smith, is there anything we should be concerned about if we have a clotting disorder regarding the AstraZeneca vaccine? And is it going to be getting FDA approval? What's the update on the AstraZeneca vaccine? Do we have it here currently in Lucas County? Are we giving it out?
So great question, Dr. Duggan. So in early March, there was some reports of concerns of blood clots in the European Union. World Health Organization came out on March 12th and indicated that based on the current literature and current studies that there was not a link between the vaccine and blood clots. Since those dates, the AstraZeneca vaccine has had some information in the literature or presenting data on 79% efficacy. There was some additional data that then subsequently came out that it was 70%, 6% effective at preventing symptomatic COVID. But the important number with this and the other vaccines is that 100% effective at preventing severe disease and hospitalization. So the AstraZeneca, as well as the Johnson & Johnson, Pfizer, and Moderna, have that very high efficacy for preventing the severe hospitalization and death. And those are really the important numbers, because you hear the different percentages, the 76, 79, Johnson & Johnson 70, Pfizer and Moderna 95, and that has to do with variants, has to do with times of the studies, the outcomes of the studies. So all those numbers are dependent on multitudes of factors. The important thing to remember is that these vaccines are very effective at preventing hospitalization and death at this point. The AstraZeneca vaccine is not available yet in Lucas County or in the U.S. Right now, we do offer the Moderna, Pfizer, and Johnson & Johnson here in Lucas County, and they're becoming more widely available, and additional supplies coming in each week to help us reach those numbers of herd immunity, so that we can get that community effect.
So one of the other questions that came in is going to have a little bit, you need to put back on your pharmacy teaching hat, and it's about dosing dependent on weight. Now these vaccines are getting tested in younger and younger people. Are they the same doses? Should they be the same doses? Would you give a 12-year-old that weighs 95 pounds the same thing that you would give a man that weighs 275?
Oh, very good question, Dr. Duggan. So most vaccines are a standard dosing, that you don't see different dosing between lightweight individual or younger individual and adults. And that has to do with drugs that are dosed based on body weight, often distribute out into fat, and you're looking to obtain a very specific drug level and on these narrow therapeutic drugs. When you're dealing with vaccines, it's about inducing an immune response. And so you don't have that dose-dependent effect that you do in, say, an antibiotic or other drugs. So most of these vaccines are going to be dosed at the same level in the younger population as they are in the older and obese population.
So therefore, it won't be too much for somebody who's little and too little for somebody who's an older adult.
Right, because you're looking to induce that immune response.
Perfect. Okay. So some of the other questions we're getting are about safety. And Dr. Smith, I'm still going to pick on you for a little bit. So these vaccines the FDA is still saying they're safe, and there's nothing else that's been reported. Can you talk to us about, is one safer than the other for Pfizer, Moderna, or J&J?
So because these are all under the emergency use authorization, the FDA and CDC has a very strict reporting requirements. So everybody that comes through the clinics, they're encouraged to sign up for Be Safe. So this is monitoring. They will send you daily texts, ask you how you feel after you get the vaccine. You report side effects. Institutions are required to report patients who come to the emergency room receiving or hospitalized for treatment. So these are vaccines that are being very highly monitored and tracked for this, and there has not been significant variances between the vaccines and the literature being reported. And they're all very safe and effective at this point. And so really do encourage the population out there and everybody out there to get the vaccine when they do have the opportunity.
So I'm going to then shift this over to Dr. Cadigan. So with all these unknowns, we're looking at boosters, we're monitoring safety. How is our public health department going to be communicating this information to us? I mean, what's the best way for us to find out if they're going to require a booster or recommend it, or if there's a change in safety recommendations or something like that? How are we going to communicate that?
Yeah, if we get changes in safety recommendations, or certainly changes in dosing intervals, new boosters, updated recommendations for timeframes for vaccination, certainly we put that out through our communications department, much in the way of all the other information has gone out. At this time it looks, and I know there's been some questions in terms of boosters. What we have, as Dr. Huntley mentioned right now, in terms of vaccination, seems to be covering the variants the variants of concern that are elevated within the country right now quite reasonably well. So we don't foresee that in the near time frame that we're going to need boosters or repeat vaccinations. The fortunate thing right now is that the state and the country as a whole have put a much bigger surveillance system in place in testing and looking for variants. Obviously the big issue is going to be if we suddenly see a new variant, and with the ability to do rapid testing within the lab, we find out that one of the existing vaccines doesn't cover a variant that a new variant that we have very well, then I think at that point you'll see booster shots and really the future vaccination, whether you need boosters in a year or so, is that information is really going to come out as we get more data and analyze antibody responses and so on, and people 6 months or a year out. And the people in the clinical trials are now on the 9-month interval coming out, so we have an idea from them very soon how long the vaccine-induced immunity is going to last. But certainly the surveillance measures that have been put in place recently, we were able to get that data saying, hey, we have one new case of a California variant here. That's going to be able to guide us, and then we'll get that information out to the public if we need to make changes.
And when you get it out to the public, best place to do it, look at the Toledo-Lucas County Health Department website.
The Lucas County Health Department website, I know our commissioner's been quite active. Our director of health promotion have been quite active in terms of holding press conferences when there are any issues of changes, and I'm certain that they'll, with their weekly meetings, the weekly updates from the commissioner, get that information out through the media to the public as well as soon as we get anything of that nature.
Perfect. And just as a side note, we'll hold more town halls like this if there's additional information that we need to and we want to communicate to the public. We had two questions in the chat box that I'm actually going to take myself. So first one is, when you talk about herd immunity, are you including those with natural immunity from symptomatic or asymptomatic infections? And the answer is yes. That includes everybody who can make who makes a protective antibody, has a memory cell, basically has protection regardless of whether it was naturally occurring or from a vaccine. One of the other questions is about addressing long-term neurocognitive effects of COVID-19. So basically, COVID-19 is a really interesting virus, and it's caused a large number of neurologic changes. The biggest ones that we all know about are the changes in taste and smell. And no one knows yet how long some of these changes are going to last, or if there's going to be any long-term neurocognitive disabilities that are going to come out of COVID. This is being studied intensely, though, and there are already large prospective groups up that are monitoring this, some out of one out of Mount Sinai, one out of Northwestern, and several other groups with NIH funding. And so this, more will be revealed on this. We don't know what the long-term effects from a neurocognitive standpoint or from chronic fatigue will happen with infections with COVID-19. And again, that's one of the main reasons why we want to make sure we protect people, especially with the vaccine, if we can do that. The vaccines are safe, they're effective. We know for as long as they've been studied, that's only 8-9 months, as Dr. Cadigan said. People are getting protection. They have detectable protection. They have good antibodies, and they're not getting reinfected, more importantly. So I want to take, I don't see anything else coming up in the chat box right now. So I want to take a minute and ask a question for everybody, starting with Dr. Cadigan, then Dr. Smith, and then Dr. Huntley. What do you think, in your opinion, as we're getting back to normal, as we're trying to start opening up and states are pulling off their masks mandates and things like that, and CDC director has a impending doom, what do we need to do right here, right now, to keep ourselves and our community healthy, short term and long term? What do we need to do?
I think the biggest thing we need to do at this point is, which is difficult for all of us because, we're going on a year of this, is certainly to continue what we've been doing in terms of masking, as restrictions drop in terms of how many people can get together, what events we can go to, using caution and common sense with those, and, limiting exposures. We all want things back to normal. The last thing I think we all want is getting back to normal for 3 weeks and then abnormal for a month. Normal for 3 weeks and abnormal for a month. And the best way to do that is to, as we've been seeing, is to gradually step forward. But we've got to keep in mind that this hasn't gone away. My dad was a firefighter, and I love fire analogies for some reason. And I've likened this for my patients since the start of the pandemic is, if this is like a California fire season, we've got lots of dead brush in the woods, we've got high winds, it's been dry, it hasn't rained. And just because we don't see a fire breaking out doesn't mean we should necessarily walk in the woods with gasoline and matches and start fires everywhere. Well, it can't be. And we're in that same kind of circumstances. The conditions are still there for things to flare up. And I think that's what our CDC director was emphasizing. Whether we get a slight slow burn and get things back down again periodically, and that's going to depend on how we react. We all want to get out and do things. And I think as we get vaccinated, certainly we can do that with a greater measure of safety, but we can't throw caution to the wind. Certainly I think kind of holding the line in terms of what we've been doing, but certainly vaccination is the real way we're going to get our things back to our normal sooner.
Yeah, I completely agree. And if I could offer, my grandparents lived through World War II and the Depression, and they certainly scrimped and saved. And I remember being a kid and even remembering when my grandmother used to wash off tinfoil and reuse it. But it's because she believed in the common good. So I completely agree with Dr. Cadigan that we have to, continue the mask wearing and social distancing. Second of all, I think we have to get vaccinated ourselves and then encourage others to do it. And then going on that point about, my grandparents, looking out for each other, which is, trying to also encourage them to do the right thing, which is wearing masks and social distancing, maybe going out of your comfort zone and offering to give people a ride to the vaccine clinics, especially if you have been vaccinated, right? Again, I think it's going to take a group effort here to talk to people, get them convinced that, over 150 or so million people have been vaccinated already. It is safe. It is effective. There's no reason to wait for the right vaccine. They're all the right one. Just get it. And until we kind of get the all clear, again, with whatever that number is, 70 or 80%, and when the infection rates get really low, then maybe we can start to relax. But until then, we've all got to stick together and do this.
Russ, your final thoughts, anything to add before I turn it over to Dr. Cooper? Because I noticed there's a couple of, he might have us do some rapid fire question and answer because there've been a few chats that have come in. Russ, any final words?
I just want to stress the importance of the most important vaccine for you to get is the vaccine that's available to you, that we don't encourage vaccine shopping. If you can get into a clinic that's Johnson & Johnson, you can get into a clinic that has Pfizer, we encourage you to get into that clinic and not wait for a specific vaccine.
Excellent. Excellent. All right. And do I have Dr. Cooper up? All right. And so Dr. Cooper, I'm going to turn it back over to you now.
Well, first of all, I'd like to express my sincere appreciation to tonight's speakers who continue to conduct the work to help our community and nation with this COVID crisis. Thank you so much, and especially Dr. Cadigan joining us from Lucas County Health Department. You know, your direction in fighting off this pandemic is really spectacular, so thank you so much. Tonight, we all heard about the concerning uptake in COVID cases. We're a little worried. We talked a lot about the importance of vaccines. They are effective and they are safe. Please encourage your family, your friends, and others to get vaccinated. Here's the point. For each person that we make safe helps all of us be safer, right? One person vaccinated creates safety for all of those around them. Finally, as we heard from Dr. Cadigan, especially if you've not been vaccinated yet, now is not the time to back away from wearing a mask or practicing social distancing. You need to stay safe. You need to get vaccinated. Thank you so much.